Okay. You're on. You're on.
Close. Hello, this is Dr. Bittiker. We're back to do one of our other presentations here. We have been doing the pauses, but today I ran across some information I thought you might find interesting, so I'm going to get off the beam here a little bit and go to something else. I'm going to talk primarily about vitamin D. Let me run some statistics by you here that might just get your interest. There was some studies have been done, and let me show you one here that's this is a study that was done at Creighton University School of Medicine in Nebraska. There's multiple other studies that will back this up, but this is an interesting one done. And in this particular study, they gave 1,179 healthy women from rural Nebraska. They gave one group of these women 1,500 milligrams per day of calcium. The other group, they also gave them 1,100 international units of vitamin D, while another group was given the placebo. Nobody knew who was getting what. Over a 4-year period, the group receiving the calcium and vitamin D supplements showed a 60% decrease in cancers. All cancers. 60%. Considering just that the last 3 years of the study reveals an impressive 77% reduction in cancer due to supplementation. So evidently the effect is cumulative. Think what that means. That means that you have in that particular study. Now, if you think that's an isolated study, that I'm cherry-picking studies, maybe a little bit, but you can go to a thing called the vitamindcouncil.org website. Massive research there. A lot of it's linked to the World Health Organization on vitamin D, and you'll see there's multiple other studies show exactly the same thing. There's other studies show a 50 or 60% reduction in across-the-board cancer, in all types of cancer. Think about that. You know, we have a healthcare system. We rank 41st in the world in longevity. The other countries that outlive us, not all of them have socialized medicine. In fact, most of them do not. That's not the excuse. It doesn't work. They're doing it some other way. The way they do it is that they're preventing those diseases from occurring in the first place rather than treating them after they occur. We are much better at treating disease after it occurs here in America than any place else in the world. It's also vastly more expensive to do it that way. It's much less expensive to prevent it in the first place. Some of these countries are doing it by accident. Some of them are doing it on purpose. Well, I want you to show you that we can do this ourselves here in America. Now, let me run some other statistics by you. Let me see here. Let's another big study showed that 70% of all white Americans, white folks, have a vitamin D deficiency. 97% of African Americans have a vitamin D deficiency. The reason for that is apparently diet, but also sun exposure. African Americans, because they have darker skin, have to get a lot more sun exposure to get the same vitamin D that lighter skinned people do because of the difference in the way their skins are. Now, this accounts for a lot of these difference in these statistics. Did you know that a man, an African American man who develops prostate cancer is 2.54 times more likely to die from it than than a Caucasian person? And also that the vitamin D deficiency is much more common in African Americans, as I said, than white folks. And also you understand that the difference between the aggressive form of prostate cancer and the less aggressive, remember on the last program, you may want to refer back to the one I just did before on the prostate gland, is that there is a test that differentiates between the aggressive form of prostate cancer and the much less aggressive. Is that vitamin D deficiency is associated with a 500% increase in the form of aggressive prostate cancer. You got that right. So by adequately supplementing with vitamin D, you can decrease the likelihood of having your prostate cancer when and if you develop it, being the aggressive form. Apparently, by this research indicates by an 80% reduction. So that's not bad. Some other things here. Let me see here. One more time here on my computer. Okay. Now, besides just the cancer preventative thing here, let me give you some symptoms analysis here. This is again based on World Health Organization and also the vitamin D.org research. Vitamin D deficiency shows up in a lot more forms than you might think. It's very, very common. In my own practice, I would say easily 80-85% of the patients as done by a laboratory test will show up as vitamin D deficient. But let me give you some other symptoms that are related to vitamin D deficiency. Frequent infections. You have people come in and get colds all the time. There's a study done at Harvard Medical School show that there's a correlation between vitamin D deficiency and the common cold and pneumonia, and particularly in patients who are in hospitals. How about this? There's a major association between vitamin D deficiency and being depressed. Remember, years ago, in Florida, we used to have these so-called asylums where people would come down here to be treated for depression, and all they would do is just have them get outside in the sun. And sunlight, because it increases vitamin D, will many times make their depression go away. In fact, studies have shown that vitamin D sunlight exposure has been found to be as effective as any antidepressant. Here's a study reported by the National Institutes of Health on the use of vitamin D for treating of depression. It works quite well. Another thing, we see chronic osteomalacia and or osteoporosis, bone loss, particularly in women. Classic example of vitamin D deficiency. You know, in children who have a vitamin D deficiency, where their skeleton doesn't develop correctly, it's called rickets. We're told we don't see rickets as much in America as we used to, but I'm telling you that we're seeing it a lot more now than we used to. That's simply just osteoporosis in children. Well, what makes you think it doesn't happen in adults that have chronic osteoporosis? So there's an association between weak bones and joint pains, and again, this is in a 2014 study. Also, fatigue. I found this out in my own practice. I would say probably 98-99% of my chronic fatigue patients and or fibromyalgia patients have a vitamin D deficiency. And in many instances, all their symptoms are simply due to one thing, a vitamin D deficiency. They're just simply not getting enough of that vitamin D in their body. And if you look at the symptoms of fibromyalgia, chronic fatigue, and fibromyalgia always go together. Muscle aches and pains, soreness, slow recovery from any type of physical activity. They all go together. They're all the same symptoms that you get from vitamin D deficiency. So if you have those symptoms of fibromyalgia, you should for sure get your vitamin D test done. Now, we do it here in the clinic. We do a test for vitamin D. I think it costs $36 to the patient. Now, I once made a patient very, very mad at me, but I said, don't get mad at me. I didn't do this. They came in from California, and they'd had a vitamin D test done out there. By the way, by the same laboratory that does it for me. And their doctor out there charged them like $460 for the same test that I charged them $36 for the test. And they kind of got mad. I said, well, don't get mad at me. I'm not the one that did that. The way we do it here at the Bittiker Chiropractic and Nutrition Clinic is that when the laboratory bills me $36, I turn around and bill you $36. I order through a thing called a lab co-op that gets me dirt cheap lab tests, and the laboratories that does it for me is the LabCorp, probably the biggest laboratory in the world. I don't own a laboratory. I just order from the company. I see no reason to mark up these lab tests when I do them myself. Whatever they charge me, that's what I pass on to you, and I can get you a real good deal. In fact, with our standard array of tests, over 70 different tests that we use on our patients, if you went down to LabCorp and ordered it yourself, and you'd pay about $1,000, or they'll bill your insurance company for that much. If your insurance company isn't going to pay for it, or you don't have insurance, or you're going to pay cash for it here in my clinic, it costs you about $199, including the nutritional report and everything that comes along with it. That's what we do here. But another thing is muscle aches and pains, particularly fibromyalgia, very, very common. Some other things we see with vitamin D deficiencies is of all things, psoriasis. Easily 50% of psoriasis patients most likely are due to a vitamin D deficiency. We also find out that even schizophrenia, paranoia, bipolar disorders, major association between vitamin D deficiency and that. Also, if you read the research done by Abraham Hoffer, and then there's another website you go to called orthomolecular.org, orthomolecular.org, or is it .com? This is one or the other. Anyway, orthomolecular.com, I think it is. You can go there and see the research done by these doctors and scientists on the use of supplementation to treat all kinds of mental disorders, including depression, schizophrenia, and others. Also, there's an association with vitamin D deficiency and myasthenia gravis, and also the MS, multiple sclerosis. In fact, you can go to University of Oregon, I think it is, and read the research that Dr. Swink did on the use of the swank diet, which is a ketogenic diet, but it's also very high in vitamin D. There's an association between vitamin D deficiency and MS. The farther north you go, the much more likely you are to see MS. Multiple sclerosis is almost unknown at the equator. Very rare you run into somebody that develops that disease along the equator. The farther north you go, the higher the incidence of disease. So these are things that all go together. So that's the information I want to give you on the vitamin D. If you have any questions about vitamin D or anything else, you can call the clinic at 800-326-5838. That's 800-326-5838. And you can ask a question. Also, if you want to, you can like this with your friends or share it with your friends. And the more the merrier. Tomorrow we're going to be covering another pause. And you should be listening to us at that time to pick up some new information. Thank you for watching.